Now we're getting into some of the nitty gritty, the guts of what the county is doing to actually help folks, not only more generally, but especially during this crisis. We have a lot of dedicated staff on both the social services side and community services side that have been helping tons and tons of people. That's only ramped up even more. Whether it's our unsheltered community, folks that need food, folks that need Medicaid applications, process and what have you. And at this point, I'm going to stop talking and let one of the experts talk about it. So, Miss Courtney Tierney, the floor is yours.
Thank you. Hello, Occoquan, and thank you, Supervisor Boddye, and your great team, Emily, Jason, and Julia. It's a pleasure to be here. I was particularly honored to be with my co-workers, Lisa and Brian. I would like to say Mr. Mealy, who had a question about volunteering with communications, I may know of someone that could use those skills. So my contact information is at the end of this, and I'd be happy to explore that further. So let's talk about the Department of Social Services. I'm going to take the control now and hope that I can move the slide. So, sometimes, there we go. In human services, we transform lives. And in DSS, as one of the local human services departments, we transform lives through safety, support, and self-sufficiency. These are the divisions that we have in DSS. We do a lot of different work, and we divide it up under safety, support, and self-sufficiency. All of the services that we provide are essential, and all of the personnel are essential as well. So we're all working even through COVID. So let's talk about safety first. Child Protective Services and Adult Protective Services are very important for our community. During COVID, we are having a decrease of reports of Child Protective Services. This does not mean that there is less abuse and neglect of children going on. But unfortunately, because the schools are closed, they are our biggest referrers. So we are not getting the reports that we normally would. So I would encourage all of you to keep an eye out on the children in your neighborhood, the children that you know, families that you know, and please report. The numbers are here. For Adult Protective Services during COVID, we are seeing a 20% increase in the need for adult protective services. So these workers do go into homes. They're often the first responder there into the home, and we look to the community to help us to keep our vulnerable citizens protected. During the COVID response, we are doing it virtually. There are home visits being made. They do ask the questions before entering. They are using PPE. Our court visits are still occurring as needed, although the court system is sort of ratcheting down a little bit and delaying some things. We are figuring out what to do regarding children who may need to be removed from their home in need of quarantine or isolation in case one of their parents or both parents are very sick from COVID. It would be difficult for some foster care families to take in a child even temporarily if that child needed to be quarantined. So we are working through that, and we are going to talk about homeless services and what to do regarding adults who are homeless. In the budget this year, and we thank the Board of County Supervisors very much, they put in $175,000 of local general funds to match some state general funds so that we can add 6 positions in Child Protective Services for an evening and weekend team. This will be very helpful. You can imagine this work is difficult, and after a long day of being in court, working with families, when you're on call and you're getting ready to go home and that phone call happens and then you're out another 12 hours, that can be very difficult, and it is a difficult thing to retain workers because of it. So we will now be able to put in a new team. The board also appropriated $125,000 for the exploration of a child advocacy center, which is for independent interviewing of children who may have been sexually or severely physically assaulted. And this will aid in prosecuting offenders. It'll support the family and the child, and it will educate the community about child abuse. In our juvenile justice programs, the Department of Social Services operates the pretrial supervision program, the juvenile detention center, and the Judge Patrick D. Molinari Shelter for Youth. The pretrial supervision census is going up because the court is not detaining and keeping children as much during this. And so the census at the JDC and the Molinari Shelter has been going down. We also serve the cities of Manassas and Manassas Park, and we have a program for children that are in state custody. State commitment is the real word, and they are also located at the JDC. We are in the capital improvement plan for a trauma-informed design for a JDC. The original building was built in the 70s. As you can imagine, these are residential, the JDC and the Molinari shelters, so we need to make sure during COVID that we are very, very clean. We are socially distancing, which is not an easy thing to do when you have a bunch of teenagers. But they are doing a great job of it, using PPE, masks, and so forth. We are canceled non-essential visitation. This can be very difficult for families, and we understand that. So we are increasing the telephone visitation that they can have. Our pretrial supervision does go into the homes. In the community, they must lay eyes on the child that has been court ordered into pretrial supervision. So again, they are wearing PPE, going out, doing virtual meetings when they can. In many instances, they're standing in the yard just so they can see the child in the front door. In support, we have the Children's Services Act. We have over 500 youth that are served when their medical, behavioral health, developmental, or intellectual needs exceed their family's ability to provide safe and appropriate care. This is being done through telework and mandated meetings. Vendors are being paid when a child is then perhaps sent to a residential facility. And this year, the board budgeted an additional $3,780,886 of local general funds. This is a very expensive program. The total addition will be another $11 million because of the match that we are required to pay to draw down the state general funds. This is primarily a high price based on the education that is required for children with special needs who are not able to be served within the school district. And even though it's education, it is in the Department of Social Services budget. So we certainly appreciate the support there. Our Family Support Services Division does foster care. We have about 105 children in foster care in the community. Fostering Futures, this is for youth that have turned 18. They were in the foster care system. You can imagine going from that into full adulthood is a difficult transition. So there is a program called Fostering Futures from age 18 to 21. CPS ongoing, when we're working with a family, there are some abuse and neglect issues, but the family is willing to work with them, and that can take a lot of time. Sometimes it's called treatment. ICPC is when we have children from other jurisdictions or other states within our community, and permanency, which also includes adoptions. These are all still going on during COVID. There are some things that we have suspended, foster care family training, for example. We are visiting our foster care children virtually, as well as the Fostering Futures. That is working out really well. The youth like it a lot. And so we're hoping that as we move forward, the state might include that we could continue some virtual visits. Court visits are still occurring. And we are, again, trying to figure out what to do. We have not had a child come in who needs quarantine or isolation, but treating that appropriately is something that we are figuring out. And then there's self-sufficiency. Benefits, Employment and Child Care Division. Most people think of that as Medicaid. And we also have SNAP. So stop calling it food stamps because it's really called SNAP. It's not stamps anymore. They have an EBT card, looks like a credit card. Temporary Assistance for Needy Families, TANF, and the employment part is for those that are in TANF and able to receive that. Energy assistance is getting ready to ramp up because of the hot season that'll be here soon, and refugee resettlement. Child care is subsidized with federal funds for persons, families that are in TANF or families with financial need. Medicaid is based on income, and long-term care Medicaid is based on income and health condition. The website there is a good place to start for applications. Sorry that this slide doesn't look right. I should have fixed it. I apologize. We do have staff at the Sudley North Government Center and at the Ferlazzo building on Cardinal Drive. I guess it's on Donald Curtis Drive off of Cardinal near Route 1. We do have staff there to take the mail, take phone calls, direct callers to the right place. We still have to scan documents. When someone drops off an application, first we have to be able to receive it. We have to be able to time stamp it, and then it has to be scanned. We do have a number of workers who are able to telework, and that's working quite well. The productivity is really good, but it is a complicated system. And we do have to be able to issue SNAP EBT cards publicly. And so we are open from 1 to 3, Monday through Friday, at Sudley North and Ferlazzo to distribute those cards. This is done with social distancing being practiced, and the person calls the cell phone, and then a worker comes out and they exchange it. We do have drop-off boxes in front of each building for customers to drop off their applications or any other kind of verifying documentation. We've had a lot of volume with benefits, as you can imagine, during this very difficult time that people are facing. Normally, in a month, we'll get 800 and some SNAP and 200 TANF applications. In the week ending April 3rd, excuse me, we were at 702 SNAP and 133 TANF just for 1 week. This is starting to go down a little bit, but you can see there, because we don't even have 2 weeks reported there, how much that volume has gone up. Now the state has waived some of the rules. Normally you have to do renewals every year for Medicaid and twice a year for SNAP, but that has been waived so that all of the staff can help process the applications. The board in the budget this year added 6 employees because our volume does continue to go up, and that was $225,228 of local general fund to match state general fund. It usually takes up to 18 months to train a new employee. We are thrilled when we can hire somebody that has benefits experience, but that is often not the case. Homeless Services Division also helps people move towards self-sufficiency. We have a coordinated entry system in the Prince William area. That includes the county as well as the cities of Manassas and Manassas Park. We have a continuum of care for homelessness. All of the providers, advocates, interested parties, the 3 jurisdictions, we all work together. We have multiple meetings. We meet at least monthly, and then there are committee meetings that meet to keep that going. We are required by HUD to have a continuum of care, and the Department of Social Services serves as the fiscal agent as well as the administrative agent. We directly operate the Bill Mayer Drop-In Center for adults experiencing homelessness, the Hildebarg Homeless Prevention Center, which helps families experiencing homelessness, and the overnight shelter, which is for adults who are experiencing homelessness. It is a county building and a county program. It is contracted and operated by Streetlight Community Outreach Ministries. And you see the little asterisks there. The Cooperative Council of Ministries and Servants at Work assist with funding and food at those programs. I know there are many churches in the Occoquan district that support this, and thank you so very much. I don't know what we would do if we had to prepare the meals, buy the food, and do all that for the persons at the Bill Mayer Hildebarg and the overnight shelter. Now, our COVID response for homeless services has been quite significant. Coordinated entry, anyone experiencing homelessness, at risk of homelessness, or needing to be, hopefully we could divert from homelessness, should always call this number, 703-792-3366. That's operational. The Hildebarg shelter is open. The overnight shelter and the Bill Mayer Drop-In Center have been temporarily combined and are now open 24/7 at the Dale City Rec Center on Minnieville. We did this because, as you know, we're in the governor's shelter in place order. Well, it's pretty hard to shelter in place when you don't have a shelter. And persons that were homeless were concerned because they had nowhere to go during the day. And so we have now opened that 24/7. Our continuum of care is operating virtually. Homeless staff is on site and are teleworking when appropriate. We also have a homeless crisis response plan that the Board of County Supervisors approved, and we appreciate that, for motel or hotel rooms. It also provides physical behavioral health case management, care coordination, laundry, food, transportation for persons experiencing homelessness who may be COVID positive but don't need hospitalization, COVID exposed but don't need hospitalization, persons that need social distancing. We have several homeless programs in the county that have bunk beds, and that is not social distancing, and that puts persons at risk for COVID. There are a number of people who are high risk based on age or underlying health conditions. And we wanted to make sure that all of these persons had a safe place to be during this. And using hotel rooms is a nationwide best practice, and we've been able to implement that here in Prince William County. So at the beginning of the pandemic, we had 186 beds in the Prince William area for persons experiencing homelessness. For the most part, they were relatively healthy, mostly families. As of May 1st, we now have 328 beds for persons experiencing homelessness of any age and gender and any COVID status. We're pretty excited about that and hope that that will save lives. The board this year in the budget added $500,000 local general fund for homeless prevention. This will start July 1st, and we're working on the rules for that. As the shelter order is lifted, one of the criteria in the shelter order was no evictions. So we are anticipating once the order is up and people have not been able to pay their rent, there may be an increase in evictions. This is not the time to increase the number of persons that are homeless. And so we hope we'll be able to help prevent some of that homelessness. These are some numbers that will be on the website. I'm certainly not going to go through them all, but our hotline for child abuse and adult abuse. There is a number there for the Area Agency on Aging to help persons 60 and older or adults with disability, how to be a foster parent. When this is over, we will start training that again, adoption, homeless services, and public benefits. That's my contact information. Feel free to reach out to me. We are in this together, this COVID-19, and we look forward to all enjoying being on the other side of it, which we're calling DVOC 20, Disease Interrupted, Virus Overcome by County Champions in 2020. So with that, I'll end. And if you would have any questions, I'm happy to answer them.
Thank you so much, Courtney. That was an awesome presentation as always. As folks can see, our human services folks, our social services folks are doing a lot of work in our community. And I just wanted to, I would be remiss if I didn't emphasize how much our investments in this, in a lot of preventative measures really goes a long way. As Courtney said, now is not the time to be evicting folks. Now is not the time to really be letting folks fall through the cracks, because as we get out of this, we will be having a lot of challenges, and we will only be exacerbating some of our current challenges if we don't do right by our own. So Courtney, thank you so much for what you do. Let's see if we have, oh, and also ditto on the shout out to the Cooperative Council of Ministries. Like you said, a lot of the churches that are a part of that are in our district, are very close by. They've been doing a lot of work for a long time, helping our unsheltered brothers and sisters, feeding them, helping volunteer at the center, and really helping them move the ball forward, and hopefully taking some of the burden off of your plate and your folks.
We enjoy them very much.
So let's see. Chat is open in the Q&A. So if anyone has any questions for Ms. Tierney, please feel free to ask. I actually just got someone who messaged me through Facebook Messenger. They are asking about the Medicaid applications, and how your folks have been sort of handling those. And you mentioned that obviously as we move through this, the state has sort of waived some of the renewal processes and stuff like that. I would imagine that's been helpful. But what should folks out there know, generally speaking, as they sort of look to be applying for Medicaid? Do we know if there's a sunset date on those waiver of renewals? What else can you sort of dig into in terms of that?
We don't know about when they may end that renewal waiver. The best way to apply is to go online and do an online application. There is also a phone number on that last slide that I had. Just understand, when you do that and you feel contacting the state, and you are, but the application comes back to us locally for us to determine the eligibility for it. I might add, many of you will recall that Virginia expanded Medicaid. When they expanded Medicaid, they said that they felt, the state felt there were 400,000 people that would benefit from it. And in fact, over 400,000 people, additional people, adults, for the most part, healthy adults between the ages of 18 and 65 were the ones that benefited. So that has been a very positive thing.
That is very helpful. Thank you for that, Courtney, because that's obviously, as we know, we have some folks that now they're in the low income community, or they're just now recently eligible for Medicaid. Obviously, as you're well aware, last we started with Medicaid expansion, so obviously there's a lot of folks that are being served by that. Mr.
Sorry.
No, go for it.
No, I was just going to say the income level is very low. However, when someone has lost their job and they have no income coming in, it is unfortunate. You can get to that low income threshold very quickly. It does include assets and what's in the bank account and so forth. But if you call or go through the online process, you'll get help and get worked through it.
Absolutely. Thank you for that. And so, yeah, Mr. Amato just said, Courtney is This was a great and beneficial overview and a wonderful understanding of the PwC services.
Thank you. I would like to add, this is Public Service Appreciation Week. So I have to say a shout out for county employees and those in human services, Lisa's folks too. But in DSS, and I have it back here, it's usually called the Department of Social Services, but we're calling it Dedicated Strong Survivors. And we are hashtag Prince William Strong. So thank you very much for your interest tonight.
Yes, ma'am, absolutely. And as I was, as I given kudos to Brian and his team, same thing goes for you and your team, Courtney. I know that you guys are working a lot of long hours, especially now, even before now, but especially as you saw. I mean, people online saw the numbers. They are experiencing a much more robust workload and caseload than they had previously. And my hope is, as we move through this and as her team continue to train people up and get people where they need to be, that we not only get to a place where we're helping folks, but also start to play some catch up in terms of being sort of behind in some of the services we are offering people as a result of Empower.
That'd be great.
Let's see. I don't think there's any other questions I'm seeing, but as with Brian, if folks have any questions that come up after seeing Courtney's presentation, just like with Brian's presentation, we will be able to provide her slide deck to everyone after this is over. Please feel free to reach out to my staff, and we're more than happy to partner up with Courtney and her team to make sure we get your questions answered. That being said, Ms. Tierney, it's always a pleasure. Thank you so much for all that you do. And yeah, definitely strong survivors. And we hope that we will get through this sooner rather than later, so you guys can get some rest.
Yes, thank you. Thank you very much.